So the topic that we are going to study is Lepra reaction, which is an immunologically mediated episode of acute inflammation during the chronic course of leprosy. So Lepra reaction is the body's immunologically mediated response, which is in the form of acute inflammation. Okay, so there are three types of reactions: type 1, type 2 and Lucio phenomena, in which type 1 reaction is of quite importance, and then comes type 2. So quickly we are going to revise type 1 reaction. Type 1 reaction is usually seen in borderline spectrum of Hansen's disease. Then if you ask which borderline, so all of the three borderline, be it tuberculoid, be it mid borderline or lepromatous. So lepra reactions are type of hypersensitivity reaction. Type 1 is type 1 lepra reaction is an example of type 4 hypersensitivity reaction, which is a delayed hypersensitivity. So it has a role with cell mediated immunity. But when it comes to type 2 lepra reaction, it is linked to type 3 hypersensitivity reaction, which is immune complex mediated. So there is antigen antibody formation. Antigen comes from M. leprae and antibody comes from our body. So immune complexes are formed which is deposited all over the body. So in type 2 lepra reaction we see systemic features. Okay, but in type 1 reaction we see the skin lesions which were already there, they become red, edematous or tender. The nerve lesions become heavily inflamed, so it is called as severe neuritis. So if constitutional symptoms are not present, for example fever is absent, so the pre-existing lesions shows erythema. Now we come towards the pathogenesis. So the pathogenesis is quite easy. For this one it was antigen antibody reaction. For type 2, for type 1 reaction, there might be a possibility of an upgrading reaction or a downgrading reaction. So as we know, if the cell mediated immunity is good, the disease moves towards the tuberculoid pole. But if the cell mediated immunity decreases, it moves towards the lepromatous pole. Okay, so this is an example of type 1 reaction where this is type 4 hypersensitivity reaction, and this is a type 2 type of lepra reaction, which is a type 3 hypersensitivity reaction. And what are the systemic features that you will see? First of all, these are very severe features. So there is going to be fever, there is going to be arthralgia, hepatitis, and involvement of systemic organs may be seen. If you ask about skin lesions, it would be new, red, tender and evanescent nodule. So how are these lesions? These are red in color, no doubt. These are tender. If you touch it, you are going to feel pain. They are evanescent nodules. Okay, nerve lesions, हो सकता है nerve lesions हो सकता है नहीं हो. So that's all for lepra's reaction.